Hello, everyone. Excited that we're getting pretty close to the Airway Anatomy Forum. And I'm so excited to introduce you to my dear friend, Dr. Rose Tan from Hawaii. Rose, thanks for joining us.
Of course, thank you for having me.
I'm pretty sure you're the only prosthodontist and orthodontist that I know. And I know for sure that you're the only orthodontist I know that's placed a skeletal expander in yourself. I saw the video.
I still have that video.
Okay, good. Now, will you share that video in Santa Clara at the forum when you speak?
Yeah, I'm hoping to actually incorporate that into the lecture that I have.
So, on the format of the forum is to show how anatomy changes with the different therapies that we offer for our patients. So, I'll be talking about tooth-borne expansion and the changes of the midface. Dr. Ferrari is going to be talking about skeletal expansion and the changes in the midface. You're going to be talking specifically about skeletal expansion, placement, techniques, thoughts around treatment planning and procedures, correct?
Yes, I will be. Having placed my own, having placed over hundreds of them, I've had some failures, successes. So it's good to have those failures in a way, of course, because then that's how you would be able to improve the technique. So I'll be able to talk about not just the successes, but definitely the failures and how I learned from them.
Now, you have a unique situation in Hawaii. I started working with Jason Kiefer and Eric Shipley, the psychiatrists from Hawaii, I don't know, maybe 3 years ago. And then really from a diagnostic side, they would come out, they would meet Dr. Rama for a sleep study and then come over to our office for some airway testing and a workup on midface anatomy. And then so a few of them just wanted to have treatment all the way across the ocean. So I was able to find you in Hawaii as somebody to work with and rely on in case there was a problem with anything going on with treatment. And now you have a really great relationship with this psychiatrist. Can you talk about that?
Yeah, just traditionally speaking, just going through dental school and the residencies, you never really have the relationship with medical doctors or physicians of that there's a correlation, a relationship with dental and medical. So because of you, the relationship that I know of with dental and medical has just vastly improved just because of your introduction with them and seeing that there's such a relationship with their mental health and how we breathe and how are we breathing with how our skeletal structures are. So we see that changes before, during, after treatment. There's the data points that we monitor. So it's really amazing to see and knowing and hoping to share that with others. So then there isn't those two silos now, the medical and the dental, and that we can actually collaborate together.
My vision, dream, whatever you want to call it, is that psychiatrists around the country on a regular basis refer to orthodontists. And I would say at this point, you're a unicorn. You may be one of the few orthodontists in the country, maybe the world, that has such a close collaboration with psychiatrists. Would you agree?
Well, I agree to a certain extent because you're also one of the unicorns. So it's not just me, it's also you.
Well, I look forward to you sharing the skills you developed, learning from the mistakes. I'll share our mistakes too, my mistakes. And then also just touching on maybe the impact that you see with families who are coming from a psychiatrist and how some lives have changed. Maybe a few case studies on the brain function impact would be incredible.
Definitely. I'll incorporate those testimonials as well. You don't know it until you hear it from them because they've experienced it firsthand. And not even just the patient, it's the family members, that either have struggled throughout, didn't know what to do, was at their wits' end. And then we are, as providers, that are looking more towards, the etiology versus just covering symptoms. So yeah, definitely, I'll provide those, hopefully.
Okay, wonderful. Well, thank you so much, Rose. Looking forward to the visit and learning from you.